You talked a little bit about some of the emotions you're going through, so fear and
Anxiety.
confusion, anxiety, but like what's pretty normal for someone that's going through this to experience from the time that you find out up until the time that you actually are going through your just surgery?
Yeah, the first thing is I said the word cancer is scary,
Mm.
and unless you know about it, and unless you've read about it, it's a scary word, and that's why I think education is important because as you go down the road on this journey, you realize it's really not as scary, and there are things that you can do um, to help you along.
Mm.
So you go through a range of emotions, and I'll be honest with you. You start off, kind of numb because when the doctor first told me I had prostate cancer, um, I just kind of went numb because I was expecting, oh, it's sort of like benign, when I did the biopsy. But once they said, yeah, you do have prostate cancer, you kind of go numb a little bit. But by the end of the day, I kind of found myself kind of going through a range of emotions until I landed in a place where I kind of felt at peace. And it was like, okay, what do I have to do next? And I kind of almost felt like I was a warrior at this point, and I'm going to do things to beat this, and whatever I have to do, I'm going to do it.
I love it. It's a great mindset to have too, and obviously we went through it together, so every day is different. But I have seen you become stronger throughout, and I think our whole family became stronger. So that's really nice to hear.
Yeah.
So now talking a little bit more about like the actual process of you landed on surgery, but what were some of the options that you were presented, and ultimately why did you decide on surgery?
Yeah, I went through, like I said, there was something called ultrasound therapy, and I thought about doing that, and I know they did that treatment at University of Chicago. The great thing about this journey you're on with prostate cancer is that you have all the options. You can decide what treatment options you go with, and your doctors will be, they'll help you, and they'll tell you they're here to support you. So I went. Surgery was the first option my doctor, urologist, presented to me, and I flat out just said no. I don't want anything that invasive. I don't want anything that had major side effects. So he referred me to a radiation oncologist, and I went to see them. And as a result of seeing them, I did what's called a PET scan. And what the PET scan does is it gives you an idea of if the cancer has spread or is it local in the prostate. Luckily, it was local to the prostate; it hadn't spread out, which was good. However, they also did a genome test. The genome test will either say you're low risk, medium risk, or high risk for getting cancer spread in the future. I was at high risk. So at that point, we decided we would go with proton beam therapy, which is radiation therapy. And we left the radiation oncologist office that afternoon thinking that's the direction we're going to go in. And as we thought about it more and more, we decided, you know what, we think surgery might be the best option. And again, I was talking to a lot of people that went through different options, and I thought, well, surgery. So I went back to my urologist who was going to perform the surgery, and he was actually surprised that I had decided to go back with the surgery. But he was pretty glad because he thought that was a good option for me.
And it's nice too that you came to that decision by yourself. It wasn't something that you forced.
Right.
And I think that's what's really nice about this journey too, is that although you mentioned doctors will give their recommendation based on the knowledge and the experience that they have.
Right.
But ultimately, it comes down to you, your family, to make that decision because it's going to impact you.
Right, exactly. And they were very clear. I mean, my radiation oncologist and my surgeon both said, my urologist both said that you have to make the decision because you will have to live with whatever side effects may come of this. Because, like I said, they could be short-term or long-term. But they were very, very supportive. So we decided to do the surgery, and we scheduled it. And at this point, we were talking, I believe, late September. We decided to do the surgery December 16th, and I thought that would be a good time because it's close to the holidays. If I have to sort of like be at rest and not kind of move around for a while, that would be a good time. It's kind of quiet that time of the year, and that's how we landed on the surgery.
Yeah, and then I'd say like if you can even break down the week before surgery, 3 days before, day before, what were you experiencing? What were some of the things that someone, if they're going through it, should expect as well?
Yeah, whatever decision you make, you're going to have anxiety, you know, one way or the other. And, you know, like I said, I would have good days and I would have bad days because I didn't know what to expect after the surgery. And I think that was the hardest part because as far as the surgery, I knew, you know, they put you you'd be under anesthesia, so you're not going to feel anything. But I didn't know what was going to happen, you know, when I woke up and how I was going to feel and, you know, the side effects. And I think that's what was kind of giving me sort of like a roller coaster ride of emotions, you know, prior to that. There were times where I felt very, very calm and I felt like, you know, this is fine, you know, I'm in a good place. And there's other times, I mean, moments I just felt a sense of unease. I guess that's the right word to put it. So, you know, the day of the surgery, we went in that morning. It was an early morning surgery. We started at 7:30. Went in, and again, the staff and the medical personnel at Northwest were excellent. Everybody put me at ease. I'm in the first room that they bring me into, and my wife and my daughter, your sister, are in there. And you know, the nurse came in. They started taking all my vitals, started putting the IV drip in, and then my urologist came in. Well, first the nurse came in and talked to me a little about saying, you know, he's going to be my nurse, and then the urologist came and talked to me, told me, you know what's going to happen with the surgery. Then the anesthesiologist came in, introduced herself, and it was just such a really calming and comforting sense that I had going in there. And so went in, and you know, the thing about surgery, when they put you on anesthesia, you go in, and the next minute you're in another room, you know, in the recovery room.
Yeah, I remember you said you woke up and you weren't sure that they did the surgery.
Yeah, I was like, am I waking up in the middle of the surgery? Because I just heard these voices around me, and I'm thinking, they couldn't have done it at this point, you know. So that was I got a little chuckle out of that. But yeah, so by that evening, I mean, I was in the recovery room by 1:30 that afternoon. By 7 o'clock that morning, they actually had me walking around, you know, with a walker. Yeah. And they recommended that, you know, to ensure that there aren't any blood clots or you know, anything like that. So, and they want you to get your strength up as well. So they had me walking twice, I think at 7 o'clock that evening and 9 o'clock, just around the hospital with the walker. The next morning again, they got up and I walked twice without the walker this time. And, you know, by about 1:30, early that morning, my doctor came in to check, you know, my wounds. Came in about 8 o'clock that morning. Came in to check my wounds, and said I looked pretty good. And part of it, he said, was I was in pretty good health for my age. And, you know, I'm 70. He said, but I was at pretty good health, so my recovery should be pretty good. He checked the incisions because this was a robotic surgery. He checked the incisions. He said they looked like pretty good. The very little blood in my urine, you know, which is a sign that, you know, things are good, no blood clots or anything like that. So by 3 o'clock, we were checked out of the hospital and on our way home.